Our next influencer is Dr. Lynn Walton-Haynes. She is the dental program consultant with the Office of Oral Health with the California Department of Public Health. And she will be pitching medical dental integration, fluoride varnish, diabetes, and pregnancy.
Oh,
and green means forward and red means backward on your remote.
Green means forward. Can I test it?
Yeah.
Wait, this green and this red are the one that says danger. Oh. It does say danger. Okay, green. Good afternoon, everyone. Oh, what a view. Look at all you real people in real space in real time right here. Wow. Okay, so my voice tends to carry. I usually don't need a mic. So is this coming out? You know that. Is this coming out super loud or just right? How about in the back? How about here? Okay, okay, okay. Well, I'm going to talk about these numbers today. We won't need the slides, just kidding, just kidding. So I'm happy to have been asked to talk. Actually, everything I need to say is right here, so we should be okay. I'm happy to say and be here with you all. I'm Lynn Walton-Haynes. I work with the state. I've worked with the state since about 1996, but not in oral health because we weren't fortunate to have that program this long. But I did work as an epidemiologist for many years. And so my challenge today is to talk to you about medical dental integration. And I don't have one data slide, so yay. Okay, so let's go forward. Okay, so today, because we're in line, let me back up and say that our state oral health plan is aligned with what we're trying to do with the California Department of Public Health and probably DHCS, but I don't really speak for them. There are representatives in the room. And so it's really nice because you're going to hear a couple of things that you've already heard. And part of it is I just tend to move. And so if this doesn't follow me, part of it is just not working siloed. So you're going to hear, even though this is a pitch for medical dental integration, as we were working on the last piece, I'm like, oh my gosh, that is so important. And we need the community health workers, we need the teledentistry, and we need to lower this. So really, I'm about all of it. But when you think about this in particular, the medical dental integration, just why wouldn't you? Because we were talking about health equity. We're talking about equity and meeting people where they are, meeting communities where they are. And, you know, they don't present as a head walking in, and they don't present as whatever's going on inside that head walking in. They don't present as a leg walking in. It's a whole person. And so you've already heard everything about why it's connected, you know, what the oral conditions are and how they're related to medical. I don't think there's anybody in this room that doesn't know that. So we're real excited to talk about implementation. So what I'm going to do this morning, is it morning? It's somewhere it's morning. What I'm going to do this afternoon in a few minutes is talk to you about a few examples of the medical integration projects that we've been part of, some that some of you in the room have helped with, and then sort of leave you with what you're going to do for 10 minutes. All right. Green button, not the danger button. Here we go. So you saw this slide this morning with Dr. Kumar, and this just highlights what I just said, which is it's the person-centered in all of these areas. Now we're going to focus particularly on medical dental integration, but also called oral health and into primary care. So a lot of different terms. They'll probably change even as we're in this room. Go out, you're going to look, it's called something else, right? We've all been there if you've been here as many generations or decades as some of us have. Well, some of you, not me, but okay. Okay, so this is just to remind you that a lot of the things that we do and have done so far are based on evidence-based. You all heard about evidence-based, so we have our U.S. Preventive Task Force and very rigorous and robust type of interventions that we know work. You know, some of them are community water fluoridation or fluoride varnish in a primary care office and others. But this is because I know you'll have these slides later. We're not going to talk about this, but also to think about innovative and promising practices. And that's what you all would be doing in a little bit. Next, looking at the most important person in the room, the timekeeper. Okay. Okay. This morning, Dr. Kumar alluded to this. This is, again, just for your information. I was told not to talk about it. I don't have enough time. But what this is there are 6 different demonstrations of medical dental integration, including this one, which is the one about hypertension and the hypertension screening that was done in conjunction with oral health. And just to tell a little story, there goes, Joanna's like, no, don't. Just, I'm gonna do it anyway, Joanna. Just to tell a little story. I mean, all of you know that this is important. And when you think of like the data, it's important, but then the one person at a time kind of story. And so just not to mention a patient's name, but when you that patient in the chair, I haven't practiced in a while, but it's still very, very poignant and meaningful when you're able to, just by taking the blood pressure in your dental chair and go, oh, hey, we're not actually going to do that treatment today. We're going to do this, and we're going to call your doctor right now and get you right over because your blood pressure is this, or your diabetes numbers. Oh, look, your finger stick shows that you're at like 400. How are you feeling? So this is important. And if we can do that in a preventive way, that's what we want to do. So that's the little personal touch. Okay, so we have a couple of initiatives that we're a part of. The state was part of, and through, is anybody from Petaluma, Sonoma here today? Yay, okay. So we were part of the Perinatal Infant Oral Health Quality Improvement Program, also known as POCI, and it's an initiative to implement models of care to do just this: medical dental integration, high quality care, and to increase the dental visit rate. So let me cut to the chase. So because of using a multi-pronged approach, which you used, and you probably wrote this, they were able to coordinate scheduling between the medical and the dental side of the EHR record, identify infants to increase the eligible infants for appointments. And they also incentivize medical assistants, you can talk about that, for increasing the number of dental visits. And all in all, there was an increase from 10%, little over 10, almost 11% to 45% of infant visits in 21 months. Next. You thought it couldn't be done. Okay, so there's one I'm not going to talk about, but if DHS wants to talk about, we're also part of an initiative that just ended. It wasn't ours. We were partners with an initiative through the Department of Health Care Services. Sorry, it doesn't roll off the tongue. I've been here long enough that it was Department of Health Services. Changed in 2007. I still can't say the new acronyms. But that is to increase fluoride varnish in a primary office for our medical office. And so we had fits and starts with that project. We were part of one of 14 states, and stop laughing, Dr. Dilmore. We were one of 14 states, but I'm gonna blame COVID like so many things. But one of the rising stars that came out of this was working with San Luis Obispo, and they have a wonderful program where they started, where it ended up being the medical assistants coming in and really taking ownership of some things they have let's see, where is Barbara, because I'm forgetting. Tell me the name of your board. Yeah, you had your cheat sheet, your medical cheat sheet. So some really small, just things that you would think, oh, that was enough to increase what was happening in terms of it's not, I don't want to say rocket science. I know some rocket scientists, but it's not that, but it's sometimes those little steps. And so that's to be continued. So if you're at Barbara's table over here, talk to them more about that. This is the last thing I'm going to mention, and I'm at time. This is part of our COSI. You can see the acronym on the bottom, or the acronym is for Consortium for Oral Health Systems Integration and Improvement. And California, so what this is a project to increase the percentage of, increase the percentage of pregnant people who are receiving oral health risk assessment during their first and second trimester, at least for our state, by a care team. And so all of these states, there's nine states in this consortium for this time. And I can tell you more about who funds them and everything. You can ask a question, and that's how we'll get that in. You'll ask questions. But what they did was they have dot phrases in the electronic notes, and they actually had the medical assistants that take over this training. And so they're actually doing fluoride varnish for every pregnant woman that comes in, or pregnant person, as we say now. And it's they do the oral health evaluation at the first appointment. And they do risk assessment. And this is at La Clinica. And when I first started practicing, there was one La Clinica, and it was in Oakland, yeah? And that was back in the many years ago. And now there are many. This one's Concord. But what I wanted to say is, and Dr. Pendekar left and had to come back, but they have, all of these are a state office. We do an inventory capacity at the state to see what's our readiness for all of this, and the long thing that the state works on. And then the work's done at the clinic. But that model, which is the clinic and the state, in our case, in California, we also invited the county. We actually talked to the dental administrator in Alameda and said, hey, what do you think? And so our partnership actually has all three. And it's so novel here that you don't even see it on the map, because they could only put two things on the map, not three. There wasn't room to put a third thing. So as you go into the afternoon or this next session, I'll be here to come around to your tables. Think about how important this is. And I didn't even talk about diabetes. We're going to work with them, but all of these things, how important this is to meet the person where they are, and where we have really kind of what's called the low-hanging fruit, yeah, to really start that life off well for that person and for that soon-to-be child. And happy summer solstice, everyone. To be continued.